Good day yesterday. I thought I really learned a lot from the sessions.
Do you need the clicker, or are we going to do it at the back? Sorry? It's not the podium, is it?
I have a few slides, so not many. Thank you, Peter. As Peter just recapped the structure of the day yesterday, there was a lot of discussion, particularly in the morning, of the problems we're facing with microbial threats and in several domains: endemic, epidemic, antibiotic resistance, and a discussion of solutions. I think of this as basically the technical domain. What are the problems? How large are they? What technologies do we have for addressing them? What do those technologies cost? And in light of that kind of discussion, what responses seem attractive? That's information that feeds into many sorts and venues of decision making, but to be simplistic about it, I'd say it could divide that into two. One is government's decisions about how to use this information about problems and responses. And the second is decisions on the part of the international community, international collective action. And so there's one set of criteria, economic criteria from my perspective, that should guide, help inform anyway, government decision making. But it's really quite a different set of criteria that would best inform the decision making of the international system. So what I'd like to do is to begin briefly by just a perspective on that point and the different roles of the international system and the national government. I'd like then to talk about the purposes of aid very briefly as I see them, and that discussion leads to a relatively neglected, what Gavin Yamey labeled a functional approach to thinking about aid. And finally, then what are some of the priorities for action in light of that discussion? So I'll try to first begin with what I think of as the essential characteristic of the aid decision as a two-stage process. And it's a sequential process. The aid agency makes a decision, let's say, to allocate $100 million over the next 2 years to TB treatment in country B. Then the government of country B responds with its reaction. So the $100 million designated for TB control in country B is actually $100 million going to a government that then responds. And that's a key part of the point that Larry Summers was making yesterday. It responds often with a substantial degree of using that money for TB control to release money that it might otherwise spend on TB control for other purposes in the health sector or altogether outside, the fungibility problem. So that's one set of problems that emerges from this two-stage decision-making structure. Within governments, obviously, there's a structure that is not just a Ministry of Health, there's a Ministry of Finance. And so often it's the Ministry of Finance that would be reallocating money. The Ministry of Finance has two kinds of questions to make. One is, what are the resource needs of the ministry? But second is often if the minister is proposing action of a certain type, let's say pandemic preparedness, the Minister of Finance's natural question is not only how valuable is that in total, but what fraction of the value of that investment will reside in my country, and what fraction of the value of that investment falls outside the country. And typically the main, but not only concern of the Minister of Finance is going to be the fraction that remains in the country. So this sets up a dynamic around aid, a donors, ministries of health, ministries of finance, where there are multiple decision-making sequentially in that structure. Briefly, it seems to me from an aid agency's point of view, there are four broad purposes in trying to influence the decision-making that occurs next after the aid agency. One is simply to ease the resource constraints that the recipient government has. If that's the concern, the fungibility problem is not a major issue. I mean, whatever easing their resource constraints becomes a goal in itself. And for the poorest countries, I think that is often quite a reasonable disposition of aid. But in middle-income countries, much less so. Second is to change by what you allocate the aid money for. You change the prices, you change the incentives that the government faces. Some things become easier to do because of the aid, and it's not necessarily possible to reallocate money away from that. So they change incentives. You change the information environment. The process of aid, when it's well done, involves a substantial amount of technical information of carrying knowledge learned in one country to another country, knowledge from the scientific community into a country. And finally, I won't get into this, but there's an element of having the international system share in the risks that individual countries face. So that's one schema for the objectives of the aid process. As I mentioned, and let me, there's been a group of us who've been working on this over several years.
It's the big green one.
Oh, okay.
Is it?
That worked, yeah. So following this commission on investing in health that Summers mentioned yesterday, there's been a working group on one of the main directions of conclusion from that on this question of international collective action for health. And the functional approach to thinking about aid that emerged from that is to think in this sort of 2-by-2 structure. The rows represent where the money actually gets spent. The money gets spent in low and middle income countries, or the money gets spent in high income countries and international institutions, for example, for R&D. And there are purposes of aid, functions of aid, that are either country specific in their objectives or that attempt to meet global objectives. And a lot of what we've been talking about yesterday in the meeting so far have been meeting these global objectives. So examples in each case, country-specific investments, simple finance of delivery of health services, disease control, strengthening of health systems is one, and by far the largest actual use of development assistance money, that upper left corner. In high-income countries, the training of health workers, R&D, there's still some degree of expenditure in high-income countries that it can be viewed as very country-specific to recipient countries. German aid, for example, I think has had a strong dimension of this. On the international collective action side, and I'll just turn a little bit more to that in a moment because that's where I want us to conclude, there's support to deal with global public goods, new product development, research, a management of cross-border threats, which has been a lot of the agenda we've discussed so far. And so that can be, that money can actually be spent in two broad places, one within low and middle income countries to, for example, assist national estimates efforts at pandemic preparedness. If a minister of finance has concluded that most of the investment within her country is on pandemic preparedness is really benefiting other countries, then she's going to be reluctant to spend the amount on domestic preparedness activities that would be optimal from a global point of view. And so they're making up that difference with external finance seems to me to be one of the very important purposes of aid, and it's a purpose that there can't be a response to fungibility to. Funding R&D often, but not always, will take place in high-income country environments. one can think of a spectrum of how fungible aid is within countries. Either it has country-specific purposes, some of which are highly fungible, health system strengthening, some of which much less so. Financing domestic efforts at pandemic preparedness is much less fungible, and then global. So there are two broad directions I want to take this. One is that resources, the substantial $20–25 billion a year of resources that go into external assistance for aid are probably not reaching, at least in middle-income countries, the poor in those countries, and it's not possible, it's not activity that the international system can effectively engage in to reach those poor. So benefiting the poor everywhere, not just in low-income countries, is one objective. And the second is to fund adequately a series of international collective priorities that are, I think most people in this room would agree, typically today seriously underfunded. Drugs and vaccines for tuberculosis and other major problems in developing countries. Certainly influenza pandemic preparedness and disease control, disease eradication and elimination programs. There are a series of inherently international actions that are not being adequately funded. So moving aid, development assistance, away from country-specific purposes, functions, to meeting these global functions is a direction that I think our economic analysis would increasingly point to as desirable. So thank you.
Thank you very much, Dean. Lots of content there.